Jen Nemo, Colorado Community Health Alliance.
Cynthia Aki, Colorado Springs.
Phyllis Huggins, Eastern El Paso County.
Dixie Wodell, Southern El Paso County.
Okay, I'd like to point out that we have the director of the PPACG, Andy Gunning, here, and we'll have him speak in just a minute and public comments. But if we could just introduce others that are attending the meeting this morning.
Sure. My name is Tim Richard with Eyesight Rehab.
Patty Dyson, outside.
Jay Summers with the media.
Cindy Rush, non-community city services.
Okay.
And Leanne. Kathy Lowry, Hurricane Coalition. Tony Haberman, I say access. Michelle Vata, community mental health.
Okay. Did we miss anybody? I think we're there. So we'll go ahead and since Joe's not here, we'll just press on with this. The consent items that we have this morning are both the agenda and the minutes. Are there any changes to the agenda? Copies are available at the front table there. Okay. Yeah, they're good. Okay. Let's just hold on. We'll do both of them in one motion, I think, we can. And the minutes? Any changes to the minutes from our last meeting on the 1st of August up in Aspen Mine Center? Nope. Okay. Yes.
Would you, everybody, it's been a little while since we've been here, when you do speak, remember to turn your microphone on? And so. Oh, there you go.
Ah, there it is. Perfect.
It's hot.
Ah, now it's hot. It's not this right button over here. You got to retrain me, you know. It's like, come on.
It's been a while since we've been here, so.
Oh, my goodness. Oh, my. Okay.
This is your last year of doing that.
Yeah. It's the age thing. I'm sorry, you know. Yeah. So anyway, we have the agenda and the minutes. Are there any changes? If not, I'd entertain a motion to accept them by consent.
I make a motion that we accept them as they are.
By Phyllis. And Jody seconds. All in favor?
Aye.
Perfect. Okay, so now moving on then to the public comments. Mr. Gunning.
Thank you, Mr. Chair. Oh, sorry. Let me just join you right up here if I could.
Sure.
Thank you. Yeah, I just wanted to, with your indulgence, just give a quick update on Joe Urban, since he's not here to defend himself. He's gone this week. He'll be back next week. As you know, Joe's retiring beginning of October. I think October 1st is his last day with this. We started the process to find his replacement and moved pretty aggressively. We had a great pool of candidates, and a lot of you have probably heard already, but we've hired Joe's replacement, and it's Jody Barker. He's going to be joining us.
Oh, no. Oh, gee.
I didn't think that was going to be news to anyone.
Sure, glad
It's a
this
small
is my
town.
last year.
So, no. Yeah, we're really, really fortunate. And we had a great interview panel. Jason from Silver Key helped us. Dixie Herring, I don't see Dixie this morning, but she was on our panel as well. It had a great pool of candidates, but Jody's got he's the right fit for us. He's got great experience, his knowledge of the community, his collaborative approach to his work. It's really a good fit for where we are with the AAA right now. And Joe's left us in a really great spot. You know, he's still with us. I hate to say that he's left us, but we're in a really good position right now with all of our programs, really doing some great stuff. So it's not that Jody has to come in and make any changes. It's just how can we kind of expand our awareness throughout the community and our reach where we need to expand our reach and just build on all the really good stuff that's been going on. So we're thrilled to have Jody join us. So we are going to have a proper farewell for Joe. Probably, I think we're zooming in on the last week in September. I can put Jessica on the spot, see if she remembers the date. We'll blast out the date. We're going to do a farewell for Joe, probably from like 4 to 6. I think it was a Tuesday or a Thursday evening that last week in September. But we'll get the details out to everybody because we'll want to be sure we say farewell to Joe. He's not going far. He's staying in the community, and we'll try to rope him back in and maybe be a volunteer for some of the stuff we're working on. He doesn't know that yet, but we'll try to work on him there. Yeah, I'm sure he will. So that's what I've got. But any questions, comments?
Is there any truth to the rumor that you're going to have a roast of Joe?
We're not going to roast him. Yeah, he's too nice a guy. So
Oh,
it'll
no. They roasted
you guys
everybody
can.
else.
I'll leave that up to you all.
Okay.
So.
All right.
Yeah, but good. So we're looking forward to our transition there too. Yeah, thank you.
It does mean more work for the membership committee.
Your work.
Thanks a lot.
Better you than me.
Your work
All
is
right.
never done.
All right.
Great.
Thank you very much.
Thank you.
Okay, are there any other public comments on things not on the agenda? Hearing none, let's press on to the information items then. We have Jessica McMullen is here to talk about updates to the bylaws, which is, we all remember now, we've talked about those and we've made some, I think, changes to them so that we can have this permanent subcommittee.
I'm
ahead.
following Andy's example. I'm Jessica McMullen, Policy and Communications Manager for PPACG, and this has absolutely nothing to do with any of the changes you have approved. Nothing. What this is, as the Board of Directors was looking at the bylaws for a variety of reasons, you guys brought up a change, the Community Advisory Committee brought up a change, they realized that there is no continuity. The ways that our notifications are phrased, the order in which things are done do not align. With our lovely new brand and logo, we decided that we would go through all of the bylaws, and here is what we did. We made the notice public meeting language universal. We ensured that all of the bylaws have a conflict of interest section, and we organized the articles to be universal. So the order in which the items of your bylaws go are all the same now.
Jessica,
Name-
just real quickly, so are you saying a universal meaning from our bylaws to the council of government bylaws? So for which,
So what the Board of Directors has was put through to all of the committees.
and how many committees are we talking? So besides ours?
That is the RAC, the Community Advisory
Okay.
Committee, the Transportation Advisory Committee, the MCC,
I know
air quality,
enough committees
water
that
quality,
continuity
and
was
joint land
important.
use.
That's all I wanted to find out. Okay.
Consistency is what you're looking
Yeah,
for.
Yeah,
so
the
consistency.
consistency.
Everything is the
Okay.
same now.
Consistency in
So
the-
I wasn't sure if there was how many committees there were, that could become a real issue if it wasn't. Yeah, that would be a problem if you have 5, yeah.
Yeah. And then we did formatting, fonts, alignment, paragraph spacing. That's why it's an information item. This is all something that, within the bylaws, it does, all of the bylaws do state that as the board bylaws change, all of the committee bylaws may be adjusted to do those as long as there is no substantial change to the content of the committee bylaws. Does anybody have any questions or concerns about these bylaw changes?
Has there been any feedback on any of them from somebody else? Okay.
Do we know what they are?
So will we receive a copy of these new revised bylaws?
We absolutely can if folks want to. It's,
Like to? Yeah,
I'll make sure we send it out to the committee.
thank you.
Any other comments or questions? I think the important thing there is that it gets the PPACG and all the supporting entities aligned, both in the types of things that they cover, but also the administrative side and the policy. Here's how things are set up. So there's consistency across all of those committees, which are, provide a very important support function to PPACG, and it's important that they kind of align.
One of the big aspects of that is some of our committees still said that every single board packet had to be delivered by hand. It was against the rules for them to be delivered electronically. It did not count, and we had not given you your public notice if it was received electronically. We fixed it.
Yeah.
Anything else?
No, I think that's it. Thank you very much. Okay, the next thing on the information items are the provider presentations, and it starts with Mountain Community Mennonite Church. It's up in the Tri-Lakes area, and it'll be Leanne and Cindy Rush. So come on up.
So I was just noticing, you have the Mountain Community Mennonite Church. Is that, we're under them, but we're Mountain Community Senior Services, so I'm not sure
I
how
think-
we
I
need
think
to
that
change
the-
that or what.
If I remember some of the discussion from before, I think that the church actually holds the 501c3.
They do.
And I think
So-
that's why that lists the church as the one, but it's really, as you know, it's really the senior
Like
services.
community,
Okay.
yeah.
Yeah,
Okay.
okay.
So ladies,
Just
you can
curious.
come around behind the podium here, and you can put your microphone on. So, thank
Okay, well, I'm Cindy, this is Leanne, and we're co-chairs of the board for Mountain Community Senior Services. And first of all, we cannot thank you enough for your support, because without it, we wouldn't exist. We are a completely all-volunteer organization. We provide transportation and handyman services to seniors up in northwest El Paso County, Palmer Lake, Monument, Woodmore, Glen Eagle, even to the Air Force Academy area as well. And the huge support you gave us bought us a new, new to us, shuttle bus to provide social transportation for seniors up there. And Leanne will talk more about that because she's our dispatcher as well as co-chair. And I handle the handyman services piece as well as co-chair. And I just wanted to say for handyman, first of all, we have never turned anyone down as long as they fit within our purview. And we do things from ramps and railings and grab bars to changing light bulbs to putting up shelves, lots of things that our seniors simply aren't able to do anymore. We have two recent clients that one had recently been diagnosed with ALS, and already she's losing some of her mobility. So we're putting railings all around, grab bars all around so that she can stay home as long as possible. We have another client diagnosed with Parkinson's, and we're doing virtually the same thing. As they lose mobility, we're there to help make it better. But as I say, we do things from ramps to light bulbs, and I have 6 fabulous volunteers. So 90% of the things that we do up there don't require us to pay any labor. So we are, for the most part, materials only, which is why our grant from you stretches so far. So anyway, that's my piece. I'd be happy to answer questions, but let's let Leanne speak first to the transportation side of things. And thank you again so much.
Thank you.
Yeah, thank you. As far as the transportation part, I do handle both the social side as well as the medical private side, as we call it. The medical private side is our volunteers use their own vehicles and transport our clients to their appointments. The majority of those appointments are medical appointments. We do have several clients that we get them to their dialysis 3 times a week. We even have a client that goes at 6 a.m. and we have a volunteer that takes them that early. So we are so thankful and so blessed to be able to have these volunteer drivers that could do this for us. We also do some drives for our seniors to go to the YMCA. So, it's not all about the medical part. It's all about them being independent and also staying healthy. The YMCA has their, as you know, Silver Sneakers classes or so forth. We have a client who brings her oxygen tank and puts it on the side of the pool and does the water aerobics. I mean, without her being able to do this, she probably would be going to the doctors more than and having more complications. So this is just something that we're able to do for our seniors up in our area. And once again, we're just so thankful that you are allowing this to happen for us. So we just want to thank you. I just want to let you know we have about 50 active clients up in that area. We also, last fiscal year, we did 4,633 trips. So I think that's pretty cool. We have about 20 to 30 drivers who are consistent drivers for us. So I think that's pretty neat. Like I said, it's all volunteer, so we are really thankful that we're able to get this opportunity to help our seniors up there.
Well, and we are really the only act in town up in our area to provide those services.
Yeah. So that's it for me.
Are there questions?
You guys have any questions?
Jody?
There's a notation here that you all are in communications with Envita to merge. is that merging some of your services, or can you speak to that?
Yes, I can. Yes, we actually have been, within the last year, been speaking with Dave over there with Envita, as well as the rest of their staff there, in helping us get more transportation up in our area, because unfortunately, we're not able to cover a lot of our clients during the week. As perfect example, this week we had 7 clients that we couldn't find drivers for, and those were all medical. So we reached out to Envita because we let them know that, look, if you guys can help us out, be able to let our clients know, for one, they for sure have a driver as soon as they make their request with us for a driver, because right now we give them 24 hours notice if they have a driver or not, because that's just the way our volunteer program is set up. Also, too, we want to make sure that they do get a drive, I mean, not only letting them know in advance that they, as soon as they make the request, that they do have a driver, but also them having peace of mind knowing 3 weeks, 2 weeks out, they will have a driver. So, yes, we've been in negotiations and talks with you guys as well, trying to get this all to work, and they have just been great with working with us to make sure that really our clients are number one, our riders. So, and our drivers now, who we have as our volunteer drivers, they want to keep on as drivers and not take them away. So, yeah.
Part of the deal is that when someone can no longer drive, they can't get to the grocery store, they can't go get a haircut, they can't visit a friend. We would love to be able to make sure that our clients are able to do all of those things. But as you can see, sometimes we can't even get the volunteers to fill the medical jobs, and those always come first.
Yeah.
So if we can work something out with Envita, it will totally benefit our seniors up in our area.
Yeah, to reach more seniors too, because right now we do not have any Medicaid transportation up there. So a lot of those seniors cannot get to their appointments, and that's also where Envita would come in to help us out to get them some transportation. And also if they're wheelchair needing accessible vehicles, they can help with that as well. So,
Phyllis, you had a question?
Yes, I do. Turn your microphone on, please. Good morning.
there it is.
Hello? Hello?
Hello, testing.
My thing with Envita, which I've been behind Dave through this thing, with helping you, does that give you, do you have to go for another grant to get another van?
No. We are planning to maintain the volunteer program up in the Mountain Community Senior Service area, and then we will utilize our accessible vehicle perhaps one day a week if there are folks that need accessible rides into the springs. And so we're going to test out the waters and see how this is going to go. For the most part, we will still be using their volunteers with their vehicles.
I see. Thank you.
Other questions or comments? I'd say one other thing, since I live up in the area, have been there for quite a while, I think that as both have pointed out, it's really important service that's being provided in the area. The challenge there, like so many organizations face, is that you have the volunteer force are seniors themselves. So part of the challenge there is that you have the aging volunteers serving people that need various types of services, and that's a continuing challenge. Sort of compounding that is that there's a tremendous amount of growth up in the area. Anybody that's been through there, you know that it's exploding. And part of the challenge there is that it's very diverse. There is no real center that pulls things together in the Tri-Lakes area. Town of Monument's trying to do a very good thing for their responsibility. Palmer Lake is kind of another little niche over here doing their thing. You have Jackson Creek in the fast-growing area, and you have Woodmore, a lot of retirees. So you don't have anything really pulling it together. So the real value and importance of a volunteer organization like Mountain Community Senior Services is that they are doing that cross-linking, if you will, going across those various jurisdictions, trying to meet the needs of that fast-growing region.
Well, Invita started out east.
Exactly, that's what I'm saying. I'm just-
He went Highway 24 first,
Right,
and now he is on Highway 94,
right.
which they have places that they stop and pick up people, or if they can't get them, they go pick them up.
Yeah, but all I was trying to say is that it's a very important role that they play in the community, and that the Tri-Lakes area is very geographically dispersed. There is no public transportation.
Are they as
Zero.
stubborn
So that's
out
kind of
there
a
as they are
challenge
out
that's
there?
compounded. So.
I have a quick question.
Yes.
Several years ago, was involved with one of the nonprofits I had worked for, and I had really wanted to look at providing some services up in the Tri-Lakes area. But one of the problems we had was that all the demographic information made it appear as if there wasn't a need for Medicaid-assisted folks up there, because you look at these huge sprawling houses and so forth. But again, people don't always look at the fact that your income is set after, for many people on their Social Security after they're retired, regardless of how long they've been on their 5 or 10 acres. They are land rich but very income poor. Have you guys been able to gather any kind of sense or data as to how many people might actually be able to qualify for Medicaid? Because I think that every time there's an organization that might be interested in helping to serve the area, everything that we can gather skews the need.
Because we are not income-based, we serve seniors, period. But Tri-Lakes Cares up there has done surveys in the past. And at one point, and this was probably 8 or 10 years ago, a big survey was done, and they came to believe that they were actually serving probably 80% of the people living in poverty, which was huge, I thought, at the time, that they were actually serving that amount of people living in poverty. But they're the ones that would probably have those
It was about 8 or so years ago that Haley and I were talking about this very issue. So I just was curious that in your own experiences of what you've been gathering just from, anecdotal information as to whether or not you feel like there's a need. It's hard, it's a hard thing to press.
On that? Yeah, because I'm the one that gets the calls all the time for seeking services. And I would have to say there's at least 1 or 2 calls a week that I get asking for help with Medicaid transportation. And I have to tell them, I'm sorry, but we can't do it. And there is no service that comes up in our area. And of course, I get a real mouthful from them, but, I only can do what I can do, right? And
I just was curious.
But yeah, there's no statistics, there's no studies, there's nothing. But I will tell you that there's a growth in our area, like he had said, but families are moving in with their parents moving in with them. All of these families have children, work, and they cannot care for their elderly parents to get them to their appointments or anything else. So that's where I see a lot recently that has been happening, where the daughters or sons are calling saying, hey, I need help for my elderly parents. So
I was just curious.
yeah, no studies.
I think maybe one of the things I'll suggest is that I'll talk with Haley and see maybe have her come down or somebody come down and give a presentation on what Tri-Lakes Cares does in the Tri-Lakes area, because they will have that demographic information, at least much better than individual nonprofits would.
Right.
I think that would be helpful just to get a sense, okay, so in very dispersed and economic status areas in that Tri-Lakes period, what does Tri-Lakes do for the community, and then what are the statistics?
Well,
that would really feed into what you're doing, if you haven't already talked with Haley.
The other problem with that also is that a lot of people make, because you mentioned the families that have their loved one that they're caring for. On the very first question on a Medicaid application says, what is the total household income? And people make the assumption that means the total household income.
Right.
But if Dave and I were a couple, and we had our parent coming to live with us, our household income isn't part of her household income.
Right.
That's a good point.
And so a lot of people think that, oh, well, my loved one can't qualify for anything because our income is going to put her out of the possibility. But an individual's income is their own income. And so there is the possibility for them to receive services to help them with that loved one living in the other person's home. So there's a lot of misunderstanding and myths that come along with the Medicaid application.
Right.
So.
And sort of the last minute comment too would be that this is probably, this data issue, demographics and how many and what income levels and the rest, it's probably typical across all the geographies, across all 3 counties.
Right.
And it's really hard for nonprofits to find the funds to get the professionals that would actually do a data survey study and provide that data. That's a continuing challenge. So
Right.
it's just something to keep in mind. Phyllis.
Scar Lakes is Palmer Lake and Monument,
Palmer Lake, Woodmore, Jackson Creek, parts of Black Forest.
but not Castle Rock.
No,
No.
it's south, it's in the county. It's
In El
county
Paso
line, it's
County.
the
Yeah,
border.
right.
Okay, that's the north, okay.
Okay.
How many volunteers do you have, and how do you recruit them?
Well, right now, let's see, she has 6 handyman, right? I would say total probably consistently, because we have a good database of probably 60 to 70 drivers. But we only have about 20, I would say, that are consistent drivers, right? So, given,
How do you recruit them?
well,
We put articles in the Tribune, a local paper up there, as well as the OCN, which is our community news, another little newspaper up there. We often get people from the senior beat, from the senior center up there. They'll put things into the senior beat, and someone will see them and pass the word. Lots of times, word of mouth is the way it gets out.
we've also put in notices in churches, up in coffee shops, on their bulletin boards and things like that, looking for volunteers.
I think it's probably fair to say that the majority of the volunteer drivers are probably also active in church activities, Kiwanis, other clubs, and other activities.
Right.
So part of the challenge then is that as we age, we're involved in a number of different things. And you say, okay, I'm going to put some time here, but then it's hard to spread that evenly across. It's just a continuing challenge. It's the old 80-20 or now 90-10
Right.
rule, where 10% of people doing the volunteering, you're active. Well, here's another thing you can do. Well, at some point that gets hard.
It's like my neighborhood has about 65 homes. We're sort of spread out, but we do have a roster. And at one point, I just sent something out to the whole neighborhood and said, we are desperate for drivers. Is there anyone that can help us out? And we did end up getting a couple. We didn't get a bunch, but we did get a couple of people to join in. And Silver Key, the lady who runs or coordinates Silver Key Meals on Wheels up in our area, she also has passed information to us about drivers because she's full right now. She has enough drivers for her program, so when somebody calls in, she'll pass that along to us. So word of mouth is important up in the Tri-Lakes area.
Just a note then, that one of her neighbors is Pat Ellis.
Dave? Kind of got that.
Do you also provide rides to congregant meals?
Yes, now they changed it just recently at the Mennonite Church. We have the lunches, is it Monday, Tuesday?
Monday, Wednesday, and Thursday, I think.
Yeah, it used to be every day, but they just did that, 3 days a week now. So, yes, we do.
And I just wanted to emphasize, I live up in Glen Eagle. We have no public transportation up there. So that if you break your ankle, like somebody did a while back, anyway, or need transportation, I mean, you're really, if you can't find a neighbor or a family member, your only option is like Lyft or Uber, which of course gets very expensive very fast. So, even if you have a respectable income, it's a high cost.
It is, especially if you need to go down to the springs from up there, right?
Right,
Yeah.
right. I know on one occasion I did that, and it was over $50 for a round trip, like $25 each way.
Yeah,
So it adds up fast.
it
Especially on
does.
fixed income.
Exactly, yeah.
CC's goal in working with MCSS is to make that seamless from Monument all the way to the Springs so Glen Eagle will become.
Super comment. We're looking forward to it. Thank you.
Yes. Yeah, we
Okay,
are
well,
too.
thank you very
Yay.
much. Okay.
Thank you.
Great presentation. Okay, next on the information or provider presentations, we have Eyesight Rehab and Tim Richards will be talking to us now.
Good morning, everyone. My name is Tim Richard, and this is Patty Wagner. We work together at Eyesight Rehab, and we just want to thank you for this opportunity this morning to present, and just also thank you for just the funds to make this possible, to be able to serve the folks that we do serve. And it's really a great privilege to be able to do that, and just even provide these life-changing opportunities for these seniors with vision loss to receive the instruction to become more and more independent. I first off want to just kind of give you a background of how we got into this. So I worked with the Division of Vocational Rehabilitation, which many of you probably know, for over about 10 years, and Patty worked there as well. That's how we met. But and we would serve individuals with blindness or low vision, providing the skills that we're going to talk about today, the orientation, mobility, daily living skills, assistive technology, low vision, all that training. And about 3 years ago, Voc Rehab could no longer serve individuals who were no longer going to work because they wanted it all to be focused on work. And so the homemakers were no longer a goal to receive services. So that really cut off a lot of seniors. And they could no longer come in to receive, like, okay, I lost my vision, how do I cook? Okay, I lost my vision, how do I travel and get around, cross streets? How do I access my computer? How do I access my phone? How do I, so many things. And so that really cut off a lot of services. So it was about 1.5 years ago that I left there, and I said, okay, we're going to figure out a way to provide some of these services. And because of PPACG, you've made that possible. And so I'm very grateful for that. Patty and I both are. So this morning what we want to do is just explain what personal adjustment training is. It's called PAT, personal adjustment training, and just the services that we provide. And so the areas that it covers is orientation and mobility, how to use a white cane, travel if people are living in the senior community, how to get from their apartment to the cafeteria or just around town or wherever. Daily living skills, cooking, cleaning, just personal management, those kinds of things. After vision loss has occurred, what's available out there. Adaptive communication, that's going to include Braille and how to access your prints, those kinds of things. Assistive technology, that's a whole huge can of worms really in the last 10 years that has just exploded with the phones, from the iPhone to the Droid. How do you access a touch phone that doesn't have any buttons, but there's many techniques and tools available for that. And we'll talk about that a little bit. Low vision, that could be lighting, sunglasses, tints, and we have a few other items we can pass around, but some of the magnifiers that we prescribe, and so that could be lighting, tints, magnification, those kinds of things. And then recreation and leisure is a big thing too, right? Like, how do you play cards and all the other activities socially that a lot of seniors really want to connect with. So we'll be discussing those critical areas. First off, so orientation, mobility, right? That's the travel skills, using a white cane. Sometimes they're
Havana.
Yeah, Havana. There you go. There you go. Right. So how do you use a white cane? What are the proper techniques? Sometimes people use support canes. So we would tape a support cane so they can identify that someone has a vision loss as well. So we have tape that you can tape white and red on the bottom, so to be. Look at that, she folds it too. To identify someone as vision impaired. And that's really a tough thing, especially someone who's going through vision loss. Just the the adjustment process can be very, very challenging. And that white cane can be really a symbol of acceptance. Okay, I need to learn how to still go on, because we come across a lot of individuals who just get stuck and they're just not ready to learn the skills. And so they're just not really wanting to learn anything, and so they don't want the services, and that does happen. So
a common misconception, though, among people with visual impairment when you bring up the white cane is, oh, well, I'm not totally blind. I don't need a white cane.
Right.
And the majority of people you would see on the street with a cane are not totally blind. They're low vision. So that's the big hump we have to get over, because, no, I don't need that yet. I can still see some.
Right, yeah. Some people are using a white cane, all of a sudden they drop some keys, and they can pick them up and see where they are. Like, hey, you're not blind. No, I'm low vision.
Sort of like that scene in Monty Python.
Which one was that?
I can still do it.
Yeah. Right. And, crazy enough, there have been people who are driving and they pull out a cane and walk, and people do some.
Can I just tell?
Crazy
So
things.
one quick story, one of the clients through the grant found out about us. He had pretty sudden vision loss due to a surgery and a hospitalization, and resulted at the hospital, and he would be the first to tell you, sometimes the OTPTs think, oh, well, we should show people how to use it. So for some unknown reason, the therapist working with him, which they're not qualified with the long white cane, taught him to walk and pound it like this. And a doctor came along and said, stop that, because they had him in the hallways doing this. And he said, you're disturbing patients. He's like, I'm doing what my therapist. So once we started working together, he's like, oh my gosh, this is so helpful. Was a very independent guy, was a contractor in the military, and a real go-getter. And once he started to learn how to use the cane, he couldn't show his gratitude enough.
Yeah. So there's a lot of great skills with orientation and mobility, and the people that we hire are certified. So Patty and I do that, and we can contract with other individuals to provide that instruction. So, we teach how to cross the street. So someone maybe needs to go from their house to go get the mail across the street, and how to assess for cars, to cross streets safely, to take transportation, bus travel, those kinds of things. We even connect people with go-go grandparent if they're not going to be using Uber or Lyft and don't have a phone to be able to access that. So those are some of the things that we work with as well. There's even question?
Yeah,
Yes.
just to follow up on the OT. My daughter's an OT, so I'm going to ask her about this.
Okay.
Well, I was just thinking, okay, for vision loss, are you guys working with the OTs in the medical community to let them know that you have this capability and the expertise, so that it's not dependent or defaults to their limited knowledge or understanding what's needed?
Yeah, it's a huge project. I mean, we will co-work because oftentimes there's other orthopedic issues, and we're the first to say, okay, we're going to address the blindness piece, but that hip problem you have, we don't know how to address that.
Yeah, it's prioritization, I understand, sequencing.
And just kind of as an example, another client through the grant totally lost her vision as a result, another hospitalization. And they had OTPT coming in, and I was coming, and I particularly said, can we all work together? So I met with the OT, I met with the PT, and we kind of developed a joint plan. But to cover, all the OTs, PTs out there, it's a bit.
I'm just thinking that
Yeah.
the expertise that you have, if you had some information you could deliver to the hospitals for the OT, PT department, then you're saying, here's what vision does, or, your organization does.
it's a good idea.
That would be
Yeah.
helpful, I think, sort of,
Yeah.
you pre-position the information, and hopefully they would get that into their training or orientation for OT, PT staff.
Yeah.
And I know over the years.
Proactive thing to do.
Yeah, over the years, like he said, we worked with DVR, and sometimes the hospitals would call us. Usually it was when a blind patient hit and the OTPT said, oh, we need some help. So I know not recently, but I'd given some in-services at hospitals, but yeah, just providing written information
Exactly.
would be
That's
That's a
great.
good idea. Thank you. Yeah, that's great.
Phyllis, your microphone? Microphone.
We can't hear you.
Good. You got it on? Yeah, you're on. I'm on. Now you may forget what I was going to ask.
Do we work with eye
You leave
doctors?
me alone.
Do we work with eye doctors? I think you wanted to ask.
Okay, your doctors, your eye doctors and stuff, do they ever recommend
Yes.
you guys?
Yes, there is a gentleman in town named Dr. Tom Theeney. He specifically works with individuals with low vision, and so he does low vision evaluations. And a lot of the eye doctors refer to him, and then he refers to us. We probably get, the majority of our referrals come from him.
Right. Well, the thing about it is, it's just like people with macular,
Mm-hmm. Yes.
and I'm one of them. And the thing about it is as you go down with this, you run into different, and they're not suggesting that you go and see somebody just in case.
Yeah, that is a big problem, especially like the retinal consultants or whatever. The doctors have so little time to even, yeah, you're going to lose your vision, and then they don't give you any other referrals to anything else. It's like there's nothing more we can medically do for you. So that's it.
That's when you get a hold of you guys? Is that what
Yes,
you're telling me?
we're trying to reach out more to put our information in those locations to be able to access that.
But the thing about it is they come up with, okay, the macular is holding, and you're doing good as far as that's concerned. But now you got to go have the cataracts removed.
Mm-hmm. And that reveals something else, yeah.
Yeah, right. So it goes on to the point of, okay, am I going to lose it, or am I not going to lose it?
Mm-hmm.
So do you start ahead of that, or
Do we start ahead of that?
no?
or-
Does
or-
the person start ahead of that thinking, well, it's a possibility,
Yeah.
do I go and start
Go ahead.
Well,
reacting now?
yeah, so I guess the answer to that is probably from both of our experiences, if you learned ahead of time, it doesn't necessarily stick with you. I've had some people, well, I want to be prepared. Well, things get laid by the side. You might have the best intentions this month, and you learn a few things, but then your vision remains the same for 3 years. Then in 3 years, it may not. But what I can tell you is we've run some support groups, especially right now at some of the retirement centers. And I've had people come in to those groups who are just kind of in the beginning of the macular, where they just need a little more lighting, they need a little magnification, but they're interested to hear other people's stories and what's happening. So I think a support group is a good place. But to actually start seeking out the equipment and skills, probably once the need arises. Yeah.
Mm-hmm. Yeah, I just want to mention one more thing on that, too. I had a lady call this week who's 72, macular degeneration, and she says, I read 10 to 12 hours a day, and I'm not going to be able to do this, and I know this, and I can live. My dad lived another till he was like 98, and I got another 20 years here, and I want to start to learn Braille. And so she really wants to do this, but that's all she really wants to do is just to learn Braille so she can access that information. So, because she doesn't like listening to books and those kinds of things. So it's hard. Go ahead.
I have a question for you. I'm Chris Sheehan Larson from Park County. We recently have done some interacting with our Human Services Department for Park County. And we found out that there is a lot of things that they do that we weren't aware of. And we've even referred some people that had some questions about providers to them. Are you integrated with your Human Services Department for what you provide?
You mean county, human services department, social services, that type of thing? That's the question.
Yeah, no, we haven't connected with Park County yet on that level.
Not Park County exclusively,
El
just in
Paso
general.
County.
Oh, I see, yeah, just the, so we're still, right now it's just Patty and I, and we're trying to reach the people that we can. So on that whole marketing scheme is, as we're building and reaching out to other teachers, because that's the thing next is like to reach out to other teachers and to contract with them to provide these services. As we grow, we got to do it in a way that's going to be able to meet the needs. And that's the challenge right now, is to get the teachers and then provide the services and that kind of thing.
The chicken or the egg.
Yes, and that's where we're just starting off to work on.
Well, it's important, like at the provider fair that we have and the rest of it, there might be an opportunity for you to talk with the veterans community. It might be with other organizations that are perhaps not aware. And also proactively try to get a hold of the county social services.
And we're pretty well-known in the VA system because they have a specialist called a VIST that refers veterans, and the ones in this area, there's either a VIST in Denver or Pueblo, and the Pueblo one tends to cover this area. So we'll make referrals back and forth with the VA. So we do have that ground covered, but...
Yes.
Okay.
Did you have a question, ma'am?
Elaine?
I had a question. Yes, I had a question. So if a patient needs a cane, is it prescribed by the doctor? How is it covered? How is it paid for? Is it out of pocket for the patient, or is it covered?
Great question. And so, so doctors don't prescribe canes. Usually orientation mobility specialists do, like Patty and I. And so if it's covered, if they're on our case, though, then we can prescribe that, and we have some of the funds to the material aids to provide those. We also have a large demo supply to be able to provide that as well.
And that's one of the material aids that we are providing through the grant. So.
Yeah. Yeah, so sometimes it's sunglasses, because that makes a big difference. If someone has photophobia, they're very light sensitive, just being able to have sunglasses can make a world of difference whenever they go outside, because it can cause extreme pain and even mobility problems. Yes, ma'am.
Okay, this brings up a question for me. I have a niece who lives in Minnesota.
You betcha.
Yeah.
I live there.
It's out of your pocket, I get that. But she's like 50, and she has macular degeneration, and she's going blind. And so my question is, the best resource for her then is to reach out to support groups and stuff like that that can refer her, because doctors generally don't?
Yeah, I've not experienced doctors really referring. Some do. It just depends on the community, on the doctor, on the setup. But there are other resources that I can meet with you afterwards and provide to.
Okay. And I would say now kind of the best bet, if she is experiencing loss and losing independence due to it, is to go online. There used to be a directory through the American Foundation for the Blind, but she can just look up services for low vision or blind in Minnesota, or even specific to the area she's in, and if she starts calling some of those agencies, they should be interconnected and saying, okay, here's the one that could serve you. I would say now is the time if she's losing it now.
Yeah. Is she in Minneapolis or St. Paul? Yeah. There's some good service providers there as well. So, yeah. Great. Okay, yes, more questions.
Interested in the rural areas. If somebody can get somebody to drive them in, they're not going to drive themselves. Is there a way they could come and get services locally in town here to?
If they're outside of the,
I'm concerned about the rural area.
Right, that's a good question.
El Paso, Park County, and eastern El Paso. There are a lot of people out there that are marginal.
Right, and I think if we don't have a center per se, but if we had a meeting place, I do know, I think I talked to you last year from Park County, and I had a couple people. We are not serving Park County because there's the two of us. We're serving El Paso and Teller, but I don't think it was you, someone else from Park County asked, could we, if a group of people were even gathered in Park County, at a center, could we come? And that would be an ideal situation as well. So the same for any of the counties where they're in the outskirts.
Well, this is back to the volunteer drivers to bring them in.
Right, yeah.
Right.
Well, just a side note, too, would be that Michelle Vaca in the back here, she started Senior Mobile Dental, sort of on that same principle, where she would take the services out to meet the need in a local area. and then it's grown over the years to something much more substantial and well-established. But again, that might be a model to try to begin to look at that for the rural areas. It's not a solution, but at least it's something to consider. Maybe there's a way to begin moving in that direction. Michelle, why don't you come on up to the microphone? Just talk to pick a microphone and just speak to it. Turn it on, there you go.
So, it's your fault for bringing me. I was just quietly spinning my wheels when I was hearing him say this.
That's right. We need to hear your voice.
But again, this is a place where collaboration is key. You know, if we're gathering people together for the vision, then let's also gather them if they need dental or any of the other services as well. And that may play into or to help facilitate that collaboration is with those electronic signs that we had talked about. And I think it was approved, you know, but having that information, you know, available to all of the clients and the providers can help us collaborate together. And so if you do plan a day of vision, then let's plan a day of vision and hearing and podiatry or whatever all of the
like an
services
expo fair
are.
or something like
yes,
that.
exactly.
Yeah.
But
More precise. It's
Yeah.
Sure. Okay.
yeah, it's not a fair of them coming and learning about us.
It's delivery.
It's delivery of that
Screening
care.
and delivery or subsequent delivery.
Yeah, and concrete people signing up, yes, I want my vision, yes, I want my dental checked out. And we can really, I think, make a
idea.
great impact that way.
Chris, a great idea. Just stay there. Chris?
We spoke about this a lot in Park County with our organization. We're called the Seniors Alliance of Platte Canyon. Because we are so rural and we're new, I've spoken to Michelle before, and it's been presented with these general questions since we don't really have any providers in our area to do that, to accumulate the process of seeing clients in a large group. I really have to say, it honestly did not occur to me to do more than one service at a time, so that's a really good idea. I'm sorry to say that, it didn't even cross my mind, but that's a great idea. But we are formatting that, and I was going to save this for discussion items, but quickly, because I do have some more items to discuss with you guys. We have set a date for our Senior Expo for Platte Canyon. It is October the 18th. Some of you that I spoke with previously at our provider meeting, I have cards, and there'll be a direct contact, but it's at October the 18th. We'll be at the high school in Bailey, and we're going to have a large forum. They've given us their auditorium and their gym, and we're really working hard on trying to make that happen, but there is a new Senior Expo about to happen. And Wendy and I are going to meet at the end of the day to pick her brain a little bit about some information on how to process that. But
There ain't much left of my brain to think.
well, I'm going to take what's left.
Okay. Any other comments or questions? I'm sorry, Miss. Yeah.
The senior centers have these providers, like, we take them to our senior center for podiatry. There's been eye things, appointments and things. So don't the senior centers around here do that?
Here, but not.
Not in the rural areas. You don't have that luxury.
Well, right, rural, we have one that's active. Yeah, and so it's the size of Delaware. And the other areas have meeting places that they meet once a month.
Yeah.
And it is for, it's not usually any other activities beyond that, and so as going on afterwards. But that lack of a central location is part of what that group out of Platte Canyon is trying to address, is that there is no place here to start from.
Okay.
Is
Go ahead.
Dave-
One question, we'll let them get on with their presentation. Go ahead, Phyllis.
Okay. Dave, don't you do, other than just one thing on picking up? No. Seriously.
Help me understand.
When you pick up, okay, when you pick up people, I know medical comes first.
Yeah.
But I also know you drop them off at Walmart, you drop them off here, there. So yours is
Your older adults can do anything. Your older adults through PPACG are eligible to take rides to bingo, to hair appointments, to whatever they need. Absolutely.
Okay, that's what I thought.
Let's go back to
All right, great, thank you. Great discussion, great discussion.
Thank you, Dave.
It was an excellent discussion and court.
It is, I
really
love
great
the
conversation we got.
collaboration here, that's great. So daily living skills is another area that we work with as far as like cooking, house cleaning, meal preparation, time management, a whole slew of things that really, that vision loss can really get in the way of. And there's a lot of techniques and products out there that can really help with that. So it's a huge life-changing access that they can receive there. Adaptive communication, we get them connected with the Talking Book Library. It's a free service. There's a lot of free services that they can receive. Even Braille, Hadley School for the Blind provides free instruction through Braille, and a lot of other classes. We try to connect them with those types of things so that they can receive continuing education in that way. Note-taking, keyboarding, use of telephone, all that stuff falls under there, especially voiceover and talk back on their phones. It's really amazing. I didn't know my phone, and because a lot of phones have built-in voiceover that just works quite well. It's actually there's an app called Seeing AI, and I tell people about this. I'll just show you really quick. Is there any print here that I can read? So, this is a free app. Yeah. So, and all you have to do is hold the phone over the product.
Common Eschenbach.
Eschenbach. It's Eschenbach, but it reads it instantaneously. So if you have mail or something that you need to read, you just hold up your phone and you hold it over the print.
SMDedge. The smart SMDedge.
It says SMD Edge. So it's not a real, I don't have any print right now, but it would even read just over the phone, right? So or over the adaptive. And it reads it instantaneously. So get Seeing AI. It's SEEING, and then AI for artificial intelligence. So there are a ton of free apps out there. Just those little things make a huge world of difference for accessing print and accessing this information. But not a lot of people know about it. And so that instruction is really critical, and I think it makes a big difference for individuals to have that. And there are a lot other. The assistive technology world is just blown up with information. That's what we're talking about here. But just even accessing their computer, emails. You think about a parent or grandparents wanting to have information with their or relationships with their grandchildren, and the main thing that they do is text now. They don't call anymore. So it's like, how are you going to access my text to be able to connect with my grandkids? So being able to teach those kinds of things, Braille note takers, Braille displays, all that stuff. Low vision, again, we talked about sunglasses, magnifiers, lighting evaluations. That can make a big difference because not everybody works efficiently under the same kind of lights.
So I was just going to say, kind of that early macular degeneration that we were talking about before, a lot of times the big three for the early macular degeneration people are magnification, lighting, and glare control. So oftentimes it's 1 or 2 visits with those people, and if we can address those 3 areas, I just talked to a lady this week, and she said, well, my only issue is lighting. There's never enough lighting. So we have a lot of information about lighting and what works best, and how to properly position the lighting for reading. In terms of sunglasses, we call them filters, and there's specialty companies that make filters in different colors. The goal with the filters is to reduce the glare, and by reducing glare, sometimes people almost feel like it's a prescription. Oh, I can see that now, but it's because we've cut out the glare. So that can help. Magnifiers don't really work well. People will just go to Walgreens or they'll see it in a catalog and buy it, but it is very specific to vision loss. The more visually impaired you get, the more intense the magnification you need. You also need to know distances. Sometimes you'll hand it, oh, no, I can't read that. Well, I'm not holding the magnifier correctly, so I may think a magnifier doesn't work for me, but I haven't learned the techniques. So just another quick story about one of your clients. She is in the stronger level of need, like 5, 6X, and some of these handhelds make it very difficult There is a little more expensive product that's an electronic magnifier. I had a demo, and she's like, do you know how, she said, it's been a year since I've really been able to see print. And so we were in the process of deciding if we could, afford to order it. Luckily, it was near the end of last grant year. But I loaned it to her overnight, and I was picking it up the next day. I told her the time. I came to the house. She's a gardener. Her husband answers the door. She's there copying down large print for all her seeds and clipping them. So she's still using it as I walk in the door. And she said, I have to tell you this morning, my mom died a couple years ago, and she said, I was in tears this morning, but I was reading some of the letters and memorabilia from my mom, and she said the tears were running, but they were tears of happiness because it brought my mom back. So what I'm going to do while Tim continues to talk is I'm going to pass around some of this for you to look at. We also have simulators. Realize these are just simulators, but if you want to have an idea, you can put them around your head. If you're wearing glasses, you can hold them up if you want still that vision. This one is tunnel vision. We have, what's this one?
Cataracts.
Cataracts and macular degeneration are going to have all different forms. So these are just some examples. If you get one with the dot in the middle, stare at the dot, because if you look around it, you're cheating and you're using your central vision. And then just reduced acuity. So we'll pass these around. We'll pass a couple of the sunglasses or filters and a couple of the magnifiers. You will see this is a much lower level one, easier to use. If you try to use one of these, you basically have to have the print up to your, for me to read with this one, I would need to be that close. That's how intense it is, and that's when you get into some of these more expensive electronics. So while Tim continues to talk, we'll just pass some of this around.
And these simulator goggles are really great for working with family members who don't understand the senior's vision loss. And they're like, how come you can see that, but you say you can't read? Because every person's vision is different. I mean, everyone's really unique when it comes to that vision loss. And so these simulator goggles can really help with just family members, and so that's good too. I wanted to mention too, even with some of the other devices out there, there's this one device called the OrCam that came out about 2-3 years ago that's using computer technology. They have robots and they want to figure out how computer vision works, and so how can I get these robots to act individually with just their own computer vision? And so they're using that kind of technology, and they have this one that device that fits on the arm of your glasses, and it has a camera and a speaker in it, and it instantaneously reads information just like what I showed you on my app, and it picks up. You can just point to whatever text you want to read, and it reads it right in your ear very quickly. It also recognizes faces, so people who can't see faces anymore, it'll say, Dave or whoever right in front of you, and once you program that in. So there's amazing technology out there that's come a long way in the last 10 years.
What about the expenses here? I mean, we haven't heard anything yet about the insurance coverage or lack of coverage. Those are things that would probably be useful to know.
So even like our services aren't covered under insurance.
Okay, so assistive technologies are not covered.
Right, yes. And so there are different grants we try to connect people with. Like there's a Howard Fund grant up in Denver that we can try to apply for some different services for funding that way too. But yeah, question.
Microphone, please.
It's early. This is totally other end of the age spectrum, but are you familiar with the EPSDT program through the state?
EPSDT?
Early periodic screening and treatment. It is available for people under the age of 21 for assistive services. If you have children that have low vision or blindness, it would be a potential source of payment.
Huh, not heard of that. Yeah. No, SWAC is another one that's in there for assistive technology, but not this one. I'll have to get that information. Thank you for sharing that. Yeah. Question.
One of the things that some people don't realize is that a lot of these adaptations are built into our electronics. So, for example, our computer programs
Yes.
have to comply with having an assistive adaptations built in. Our phone has it as well. And I think maybe for the little younger generation, meaning younger than me, who are so used to using electronics all the time, knowing that that's available should be helpful to them. It's a little harder maybe for people who don't use computers that much or whatever.
Right, yes, and that is true. That's a good point. Thank you for sharing that. So recreation and leisure, there are also a lot of adaptive games that you can get. So there's a couple catalogs like LS and SMACs that provide a lot of these. But you can get large print playing cards and Braille on trivia cards if people know Braille. And even just on your phone, there's a lot of games for the blind and low vision now being created on your smartphone. So that's recreation and leisure. And we provide all of our services at home, so we would drive out to the clients and work in their home environment and identify the areas of need there. And so there's vision rehabilitation therapists, which both Patty and I are. We're both orientation mobility instructors, and I'm the assistive technology specialist, and she's the low vision specialist. So. And then possible different adaptive equipment, we've already mentioned a lot of these things. So that's on there. Let's see here. All right, any other questions? I know we've asked a lot. Oh, their hands up. Yes.
I wanted to ask you for a couple of minutes. Just my experience working with seniors and also with personal situations with family members, the difficulty of having them being willing to accept.
Huge.
Yeah, the pride issue. We have a lovely person who's not a blood relative, but she is our children's grandma. We call her Grandma Karen. And she's had some mobility issues and has not wanted to use anything other than her cane, and she was going to not come to her son's graduation because she didn't want to be in a wheelchair. And was willing to forego coming to the graduation because she was embarrassed and didn't want to have to be in a wheelchair. So I took her and I put her bum in the chair and I said, "Shut up, we're going."
How'd that go?
Yeah. Well, 25 years, she's not surprised. But I can see where this could be an issue also, because you mentioned it when you were talking about the cane. There's something that cane represents, and it would be, I can see, and once she sat in the chair and she realized but for her, it wasn't so much the embarrassment or, for her personally, it was one more thing that she was giving up.
Yeah, that loss.
And so as far as the experiences you guys have had with people that are not willing to take that next step, have you found that once they get basic and you start to get some opening of willingness, do they tend to open up a little bit more and they see how it helps, and then it just kind of blossoms?
That's a great question. So even just this last week, I was over at Liberty Heights Senior Retirement Community, and we did a Living with Vision Loss seminar. There was about 17 individuals there, seniors, and there was one lady in the front row with her husband, and she was shaking her head. You could tell that everything about that conversation that we were having made her feel extremely uncomfortable. And she actually left before the discussion was over, and her husband just stayed back. And so some people, and I went over the whole adjustment process, DABDA, the denial, anger, bargaining, depression, acceptance, that whole piece, and just how that can take about a year or two sometimes for people to adjust. And it's that slow adjustment. Because I had another lady who just said, "Oh, I can't use my phone," and I said, "Well, I can teach you. It takes time. It really is. There's no substitute for that time to adjust with that information
and is that support. Part of the services, though? So as you're doing that, it's not like here's therapy services you're providing as well as the training. Is it all really commingled?
Yeah, it depends.
As far as the relationship with the individual that you
right.
have? Okay.
And some people, like coming to a group, they won't come, but if you can go to their house and you can walk with them through that journey and work on the things that they are ready for, and then slowly that opens up the door for other options for them to learn new things.
And it is that counseling element, and I think we both recognize, like I mentioned, the three things. Someone might just say, well, if you could come and help me find better lighting, that's all I need, nothing more. Because lighting is something that we all need, right? But once you get there, it's kind of that counseling. Okay, we did lighting. Any other issues? Oh, well, I don't go outside anymore. Well, why not? Well, I'm afraid I'll trip over a curb. Okay, let's talk about that. And then, talk about the cane. And that isn't always a sell, but I say a lot of it's learned by doing. And that's why it's nice that we have some demo equipment. It's like, well, let's try it. Let me show you what it can do. And once someone sees, oh, that found, another client that I had was at a group, and he was others were trying to talk him into the cane. No. He was my most dramatic person. Older guy, hearing impaired, vision impaired, put the cane in his hands finally. He was afraid to go to his mailbox because he had some rough terrain. We walked, and he was kind of wobbly. Boy, the minute that cane got in his hand, I've never seen it be so instant. He stood up straighter, he walked, he's like, this is wonderful, why didn't I do this sooner?
Yeah.
Well, it's usually not quite that soon and that dramatic, but he's an example.
Well, one of the reasons I asked that, though, is because with a lot of our other providers, their services are
Categorically?
Yeah, there we go.
Categorized.
It's separated out with the different things that they do. So whether it's case management or transportation, or with our services through the aging center, and and the counseling services and things like
So
that.
ours are separated, the case management, which we usually do in the initial, and then education when we're doing the actual training.
And that's what I was
And
curious about on the
counseling,
thing.
we do have a counseling category that we utilize as well.
Which is what I was looking at on your. I actually was not playing on my phone.
And material aids, which is what we are also talking about with some of the aids.
So you've got the 1, 2, 3, 5, the 5 different categories. Okay.
Yes, and they all help.
Bill, you had a question? Microphone?
Well, just a comment. Mother in her late 90s, she was an avid reader all her life, but she got to where she couldn't read, and she got a scanner that put it on the TV set, so she read right down to the end.
Yeah,
using
right.
that.
Like a CCTV. Yeah.
What can be done?
Yes. You're right. Thank
Excuse
you.
me, sir, just a real quick question. Hopefully
Yes.
it's a quick answer. Okay, as far as the lighting in a home, is it something as simple as maybe making the wattage more powerful or not?
Not.
It depends. Yeah, right. It just
It
depends.
could be, but just a real simplified answer. Again, somebody I just saw this week, she's like, well, they don't make 200 watt anymore. That's what I need. But she had a floor lamp with a typical shade, and that's general room lighting because the light diffuses everywhere, through the shade, up to the ceiling. So we haven't tried yet, but she may do well with lower wattage, but closer to the material with an opaque lamp, a reading lamp that shines right on the material. And just as for your own reference too, there's a lighting principle that if you half the distance, with this type of lamp to a material, you quadruple the power of the light. So sometimes it's just making those kind of modifications, and then you can do with less wattage. But there's different temperatures of light that work better. So there's a lot to it. Usually when I see people, they're like, who knew there was so much to
It's
light?
more complicated than you would think.
Yeah.
It really is. Yeah. Yes.
Jim?
You'd mentioned that insurance does not cover this particular
Correct.
service. What is the average cost for a person to receive these services?
So the average cost, it depends upon the contractor or what that is, but that's usually between $60 to $90 an hour.
which
Yeah.
seniors cannot afford.
Therapy.
Right.
Yes, are you in the seniors blue book? And what is your website?
You mean the yellow book? Or the
Yeah, well, is the blue book.
Yellow
Oh,
book.
There's two of them.
Or is your
I don't even know about the
information?
blue book.
I don't know.
Yellow book we are.
I guess we, yeah.
I don't know about the blue book.
Do you
We'll have
think
to
your
look.
information is out there for people to really, see and say, oh my gosh, this is a service I can use?
Yeah, we're continually working on that as we grow as well, and we
Do
reach
you
out
have
to
a
other teachers.
website, a web page?
Yes, I do have. It's eyesighrehab.com. And I'm also in the middle of developing a nonprofit called Eyesight Connections to provide these free services and monthly events and things like that. I'm developing another website that's going to have all the resources for individuals who are blind or low vision throughout Colorado. It'll take a while.
Jody?
Are you familiar with the Next 50 initiative for funding?
I've heard of it, but I haven't really studied it.
Take a look, just Next 50 initiative online. They're out of Denver. They
Okay.
have over $200 million they need to get rid of.
Well, I can
I
do
think,
it.
I think it'd be an excellent
Take a
opportunity.
note.
Yeah, right, Next 50, right. Yes.
Let me put that in my phone.
Yeah, they need to get rid of it. Okay, thanks.
They want to get rid of it?
So what is the Next 50 initiative?
It's Next 50 initiative, right. They were the nonprofit that was established to receive the closing of the InnovAge PACE program, InnovAge specifically out of the Denver metro area.
Well, actually, I'm going to, let me
And
correct,
you
yeah.
can qualify some of that, but they have a specific amount that they have to distribute. 80% of their funds distributed every year have to stay within the state of Colorado to serve seniors in innovative ways. And we've heard from some presenters who have received some of those funds. And so it is an ongoing, they're distributing twice a year.
And the reason for that is, for those of you who, I was working for a PACE program here in Colorado Springs and for El Paso County, but the company was Total Long-Term Care, and then it's become InnovAge. It is the second longest program in the entire country. So they've probably been providing the PACE program for probably close to 28 years. San Francisco was the originator of the whole idea, and Denver is the second next to them. The reason for the change and with the initiative is because for whatever reason, I will put my public commenters to the side here, they decided to go for profit instead of staying as a nonprofit. So because they were making that change in all these years, they'd received the nonprofit status to be able to do that. The Attorney General for Colorado, the deal is that then you need to take funds that basically you got much discounted and set it into this fund, and that's what developed into the Next 50 initiative. That's where the fund comes from. It's from the monies that apparently were saved over the last 25 years from their program. And so that's where it's come from. And so because it was initially because of the senior services that they provided, it was set aside that it had to go back to actually then give more senior services as well.
What was the amount again, Jenny?
It was an ungodly amount of money.
Yeah, the base amount is over $200 million, but they're distributing, I believe, between 5 and 10, or around $5 million every year. I think it's a 5% that they have to get rid of. So, which would.
Thank you very much for that discussion. I think it was a very important piece to get that insight into the funding that might be available for this type of service, as well as others. Any other questions for our presenters? Very good.
Thank you for your time.
Okay, so the next on the agenda, item number 4C, is AAA Director's Report. Since Joe is not here and since Jody is not yet installed, I think unless
they're going to
Melissa-
install him? All right. Do we get to
Unless Melissa has some comments that Joe passed to her?
All right, so this is Melissa Martz, and I will share a couple of things just to kind of bring you guys up to speed, or some things that you may already know about and just good reminders. So we have started doing webinars for our Medicare 101 and our Social Security classes, and those have been going really well. We are still always looking for, the part of why we're doing those webinars is to have more flexibility to do that in rural communities where libraries or other resources might have better Wi-Fi connections and be able to bring people together and do some, viewing parties together. But also some folks do have that capacity in their home as well. So we are really excited about those and continuing to get the word out, and really are happy about doing that. Our SHIP folks just did their big training up in Denver last week to get back up to speed with all the policies and procedures and changes as they get ready to go into open enrollment, which is October, November, December, something like that. And then our ombudsman, Scott Bartlett, and some other folks from our community actually presented at the National Department of Human Services conference that happened 2 weeks ago, and they presented on the elder shelter model here in Colorado Springs, or El Paso County, I should say. And so their model is just a really well-run, super collaboration between a lot of groups here in our community to get seniors who, folks find them victims of abuse and get them into the right place and get them the care and support they need until they can get back on their feet. And our program here is amazing. And then for some folks, if you're not aware yet, PPACG is working on the 25-year transit kind of update. So every 5 years, PPACG has to update their transit plan in order to continue to get the federal monies. And so there's a regular transit plan, and then there's a specialized transit plan. And so they have committees that are meeting talking about that, and that area is for our MPO region, so it's not all 3 of our counties. It's primarily kind of El Paso County and rural areas of El Paso County, and a little bit up into, I think, Teller. And so that is just a really great opportunity right now to be thinking about specialized transit, what resources need to be changing, and all the work that's happening with that. So there will be public comments that will be happening starting in, I think, October. There will be 2 at least public, so there will be a total of 4 public comment sessions, and I can get those dates out as I hear about them. But if anybody has any comments or thoughts about either regular transit or specialized transit, feel free to share those with me as well, because I am on the specialized transit committee that's meeting.
Just a quick, reflection would be that since we've established a subcommittee, this might be something where transportation, transit, specialized transit might be one of those things that the subcommittee could decide to say, okay, let's take a look at that just to see, as this process evolves, as the discussions continue, is there a piece that really focuses on seniors and some of the needs that we have across the three counties? That might be something to look at. The other question, or sort of other comment, would be towards Dave. From an NVIDIA perspective, are you privy to this ongoing discussion? Yes. Okay. Same thing with Silver Key then, as far as their transportation? Yes. Okay, great. Comments, questions? B, you had a question?
No, I was thinking that's all our senior coalition.
Okay.
Some of that's being handled under the MCC, I believe.
Okay, thank you.
Under the TAC as well, probably, right?
Yeah. So the TAC membership actually ends up showing up primarily in the regular transit committee that's meeting, and specialized transit has a lot of the specialized transit individuals and folks that are sitting around the table there. In addition to Jill Gabler, the city councilwoman from Colorado Springs, and Sharon from Fountain is on that committee as well. And so, yeah, there's some really good voices and folks there, but sometimes I think, there might be other comments that we might not think about.
Right. So just for those who might not be familiar, TAC, Transportation Advisory Committee, is similar to us. So we're the RAC, they're the TAC, and there's also a CAC.
Melissa, one thing I would like to just mention, that you talked about our team, the Ombudsman, going back and doing the presentation about the elder shelter. I actually would really encourage anyone, if they'd be interested, in attending the long-term care ethics meeting. It's the first Friday of each month at 7:30 here in this room. And the reason it is connection with the elder shelter is because the elder shelter program came out of a strong need and a concern that when the law was passed about the protection for our elderly, our law enforcement, particularly Detective Chakowski and his team, were going into situations where it looked like there was abuse going on, and it was better to remove the individual who was causing the abuse, but then the person who was the elder was then potentially being left in harm's way because there was no caregiver. Or perhaps the elder person needed to be removed from the situation for their safety, but there was nowhere to take them. And it was out of that committee and those conversations that a few of us got together and started talking about, okay, well, what are the problems? Well, funding is a big issue, so maybe there's a nursing home that'd be willing to take them temporarily, blah, 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 blah. Well, 2 years later, I believe it's well over 70 people have been removed temporarily, given a safe situation, and now we have probably 12 to 13 skilled facilities all participating with this opportunity, and it all came from that meeting. So if you ever have an opportunity to want to really see, I mean, we see a lot here. We great presentations. You guys have always lined up great people to come and talk. But one of the things about that particular meeting that's so great is it's actually the providers who on a daily basis are working with our seniors and to be a part of it. And there's usually 50 people. And then directly after that meeting, an hour later, about 8:45, is the behavioral health subcommittee doing the exact same thing. Ethically, what are we doing? How can we help each other? And so it goes until about 10 o'clock. So it's the morning of those two meetings back to back. But if you've ever really want to see good, solid professionals getting work done, that is the meeting you're going to want to attend. So it's the first Friday of each month in this room at 7:30 in the morning. It's a really great, and that's where that came from. That's where that group, that's where that program started from.
Yeah, Bill is just shaking his head back there since he had to drive in.
No. You're going to want to spend the night, Bill.
Morning now, Bill. You got to make that meeting once a month.
That's right. But even if it's a one-time thing that you go just once, right now a big part of the topic is worrying about our seniors who are in nursing facilities having the right to vote. Because guess what? That's a problem for them once they go into a facility, whether it's assisted or nursing. And that's a big topic of discussion, is making sure that they still maintain the right to get their vote in. And they're starting that now as it's preparing for November. So.
Melissa.
Wendy brought up the presentations that our providers give. And there was a time that we would have people come in and speak to us who we didn't fund, who were not our providers, like maybe somebody from DHS or a law firm that did pro bono work, or, and since Carrie left, there was kind of fallen by the wayside of that. So I'm asking you guys if there's something that you would like to learn about that our providers don't do, but you know there's somebody in town that does. If you would let either Melissa or I, or Jody, I'm just starting to get that one, just let us know what you'd like to hear about, and then we can get some specialty speakers in here maybe every other month or so, in addition to our providers.
I really appreciate that reminder, and that might be, again, from a subcommittee perspective. Maybe we funnel the topics, the issues, the organizations that might be of value for the broader group here, and that the subcommittee then has a role in coming up with those types of things to assist the AAA staff. I think that'd be a really good handshake. Any other thoughts and comments? Thank you very much, Melissa. Now you can get back to taking notes, right? We love this multitasking. So from the chair perspective, the only thing I wanted to throw out at this point is that some of you know that I'm involved with a HOA and a FireWise committee, which is wildfire prevention, mitigation, not counseling, but getting information out to residents, helping them mitigate and things like that. Our HOA president had written a letter to Representative Terry Carver about 2 months ago. And Terry Carver is the representative for the Front Range, basically from about Palmer Lake down to Air Force Academy, whatever, up against the Front Range. And Terry Carver, is on her major concerns that impacting us are on wildfire insurance companies. So this letter went to her, so that resulted in the meeting we had yesterday afternoon for an hour and 20 minutes. So the HOA president, myself, and Terry Carver. What I wanted to touch base on is that, the focus was more on the legislative side and how can we better understand what the state has available or prod them to perhaps provide more assistance, support collaboration, or whatever it is. That's kind of the tone and tenor of the discussion. I kind of brought in, not surprisingly, the seniors and the
multitasking at its best.
and the seize that opportunity, right? And funding and a necessary need for collaboration. One of the things I raised with her, I said, okay, here's some real substantive things that I think a lot of people are just not aware. The Camp Fire in California, Paradise, that town, no children, teenagers, or young adults died. 0. 46 victims. What was the average age? 71. 71. Okay, it's pretty much of a retirement area, but I mean significantly, but still, 71 was the average age. Youngest was 39, oldest was 95. Most victims were older, had physical disabilities. Some refused to leave. They were unable to see, hear, smell the impending danger or threat, or lacked the cognitive abilities to react to it. So that's the reality in that community. Tie that to U.S. aging population. This is what I was talking to Terry about. In 40 years, the number of adults over 65 will have doubled. Today, older adults, roughly 49.2 million. So, by 2060, projected at 94.7 million. So this is the stark reality that we're trying to put out there. The real key that I take away and what I pushed with the representative was the need for collaboration and working across boundaries. Jurisdictions, nonprofits, a whole bunch of different people have to get together along the lines of what Wendy was talking about with the ethics group to look at the issue of, okay, seniors, those with limited vision or hearing or cognitive abilities or physical disabilities, when you look at an emergency situation. If you have a wildfire, okay, so how do you get people out? Is there a plan from that facility, whether it's Liberty Heights or it's Bethesda Gardens or it's one of the big ones downtown, and who has the responsibility? Who has insight into that? What about the emergency providers? Are they aware that you might have 15, 20, 30% with physical or medical issues that you have to somehow factor that into your response capability? So it was a lengthy discussion. Representative Carver is very much engaged in these types of issues. I'd like to say that there's some sort of an immediate, we got the problem fixed. It's a long-term effort, but fundamentally, I think the important piece that I wanted to get across here is that it really behooves each of us in our volunteer capacity or paid capacity, whatever it is, to really understand that in your area, your neighbors, if somebody has a physical limitation or disability, if the power goes out, how are you going to take care of that or assist that person? One other sidebar that I threw out to her is that in this wildfire mitigation, this FireWise committee that I'm chairing, we came up with a concept last week at our monthly meeting, neighbor to neighbor. So in addition to the things that we as volunteers are going to do to get home assessments out and to do mitigation, chipping, and all that kind of stuff, we're saying, okay, there are certain individuals in our 200 plus homes, about 700 people, that have either they understand the need, they want to support, they want to participate in mitigating, and the rest of it, they just don't have the money, the wherewithal, whatever it is to do it. So we came up collectively and said, okay, we're all volunteers anyway, but in addition to the things we're doing here, we think we'd like to work with an individual, Maggie is her name, and help her begin the mitigation process on her home, just on a volunteer basis. And what we're trying to say is that, okay, so we're already volunteers in Firewise, but nobody lives right next to her. But, so we'll provide 1 or 2 people to help work on this project and try to recruit neighbors in her immediate area to break down those barriers between residents. You know, I know that you're there, but hi, how are you? And that's the length of the discussion or understanding what your situation is. So we're really pushing that neighbor-to-neighbor initiative. And I would throw out that it's much of what you just said on the ethics thing. It's just like getting to know, understand, and accept some degree of responsibility for those that might have some limitations in your own neighborhood. Really, really important function to perform. I think we're all kind of leaning in that direction already since we're all volunteers. But it's one thing to really try to, I guess, expand and maybe energize that in each of our neighborhoods. Okay, I'll stop. Chris?
No, it's more on that topic. It just so happens this was in one of my discussion items. We actually, during our last board meeting, we had our fire chief, and I'm sure you know John Van Deer. He's our Firewise. It's Fire Adaptive Bailey. They actually have already formatted a program, and we're bringing in a guinea pig group of seniors, and we're going to teach them scenarios and make them practice the scenarios and give it to that, test that program out. It's already formatted, documented. We're testing that program out for evacuations specific to senior needs such as medication, their inability to transport themselves.
Exactly.
They've formatted it. It will probably be something that they will share. They're taking it to kids that are latchkey at home and they don't know they're there. So we just literally, Marianne, the president of my organization, and Joe and John have formatted that information, and the guinea pigs are set to go in 2 weeks. So we'll share that with y'all.
Yeah.
It's an incredible program that they're trying to create, and they've done the same thing. They've jumped into that. But an amendment to that for myself is one of the things that we have is I think we have the Red Flag program. One of the things that the Red Flag program does not do, it does not recognize an individual in a home that is non-ambulatory, that's on oxygen. So our fire group and our citizens, we're approaching our government, local government, to change our system. There is a system out there that's been recommended that actually does that. That people, it is a volunteer thing that people call in. They say you move into a neighborhood and you call and you say, my mother is non-ambulatory, or my mother's on oxygen.
Yeah.
And the last fire cycle, they didn't want to jump into any changes within the system. So now they're going to start approaching it this next system. So as a community, we're doing that. But the best part that I see in connection to what you've mentioned is the fact that they've already set up this protocol, and hopefully it'll be shared statewide eventually.
Yeah. Let me just kind of piggyback, too. It's sort of just saying a comment here would be, we all know that in a fire emergency, there's places already identified, and there's training, and there's provisions made for pets, to include horses and dogs and the rest of it. Well, what about for seniors or somebody that has disability or limited mobility? I'm just saying.
It's legitimate.
Yes, ma'am.
The city of Fountain, actually, our police department set up something.
Can you get on microphone, please?
Here you go.
The city of Fountain recently set up something, our police department did it, and I'm not sure if it's Home Safe or Safe Home. And you actually call the police department, or you can go online, and there's a form you fill out. And it's to anticipate, and they started it, I think, thinking of probably autistic kids, because we seem to be losing several of those in our community. But you fill out the form, and it's for any age person now. And you go in and you name, address, physical description, and then the thing that's really cool about it is they went on and they said, you know, are they attracted to water? Where are their favorite places to go? Where would we start looking first? If we approach them, should it be with lights and sirens, without lights and sirens? And then you provide a photo of them, which my daughter taught me how to take a photo on my phone, go to Walgreens, download it, print it, you know, to go with it, and which is a good thing. I'd never really done it before. I'd always just handed her the phone. She made me learn it. Anyways, but and you give it to them, and then every time that person's name or address pops up in the system, that is actually popping up in our dispatching system with a photo of the person and the triggers or places to look for them. That was something we just developed internally, didn't have to go to the state program, wasn't major. From the time they came up with the idea to the time they implemented it was months. So you might, Fountain PD is very open to sharing it with anybody, so you might talk to your police or fire department about that. And but you know, and 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 the fire department is now implementing it also. If I were to call for an emergency with my son, say, having a seizure, they would know immediately what kind of seizures he has and stuff. So, but maybe that's, legislation's great, but sometimes we want to take care of things in months, not years.
Thank you, that's a great share, thank you.
At the risk of burdening the new subcommittee, this might be another issue to look at as far as a topic that we'd like to hear about, maybe from the Colorado Springs Fire Department. How do you deal in emergency response or responders and seniors? Whether it's private homes, whether it's in a gated community, whether it's in an assisted living, or whether it's in a long-term care facility. Those are types of things, again, that I think would really be beneficial to help us, sort of raise that knowledge level across the various organizations, things we talk about.
And so El Paso County does have kind of emergency preparedness committees that do talk about these issues. However, I think that there are huge gaps. Kent is actually on a committee for how do you plan for folks who have dementia, and how do we get them out and get them to the places they need to go. So there are some conversations happening. I think the county, tries, but there's a lot of room to continue to work. And so I can actually work with the subcommittee, and maybe we can bring Kent in, and he can talk more about that, and just kind of continue that conversation. We have somebody in the back, too.
Just a minute, Michelle, just a minute. So I've been privy to a scenario-driven thing that was done with United Medical Center, the hospital. And again, that was emergency treatment. Okay, power goes out. Here's disaster in the community. It was driven by Peggy Littleton when she was a commissioner. And, a whole bunch of different things there. But again, it brought together all the various agencies and said, okay, if you're out of power for 24 hours, hospital, no power. Okay, so what do? You got backup generators, that's great, okay. But then you look at the ramifications and the cascading effects. If that goes to 48, to 72, to a week, to 2 weeks, everything from food to medical to home care to, your family versus the needs of that emergency group, and it's just complex. So I would just say that there's a lot more than just discussions and comments. There's some active duty planning, rehearsing, preparation that is being done across many different fronts. The only point would be somehow that we would try to get some sort of, higher level view of that, knowing that there are a lot of things going on, so that we walk away feeling, okay, people are working this thing. It's not like, oh, geez, what do we do now? No, we want to really understand that there are a lot of very bright, capable, dedicated people and organizations working that. And the county is one of them, an OEM, Office of Emergency Management. Michelle.
So just real quick, has anybody heard about Nextdoor?
Sure.
Yes. Okay, and I think that when you were talking about neighbors on neighbors and stuff like that, Nextdoor is a fabulous platform to bring those neighborhoods and neighbors together. But I think the issue is whether or not the older adults who are not on the internet and that kind of stuff, but the other neighbors who are, at least if somehow it's identified, okay, just so you know, these neighbors may need help in an emergency situation as information's put out there. But it's just a free platform. I just wasn't sure that it might be something to use.
Dixie?
I am familiar with the Nextdoor, and I get on there not every day, but that pops up when I check Facebook or if I'm on the computer. But my experience has been most of the people in our community that are on there are the younger people. And it's usually, my dog is lost, my cat is lost, those kind of things. Exactly. But it's also gunshots in the neighborhood kind of thing. And so,
but
it's
an emergency situation, I think it's out there, then that it can then be lit up. Okay, we need to, get out of our neighborhood. Mrs. So-and-so or house on this street, make sure on Turquoise Drive that neighbor's getting help out or something like that. Just for emergency situation.
Chris?
We've had kind of the opposite with Nextdoor. We have one of our board members, he actively puts notices for volunteer drivers for seniors on Nextdoor, And we've gotten most of our volunteer drivers, taking someone post-surgery, kidney dialysis, we've actually gotten most of those from next door. So it can work for a
That's cool.
senior application.
Yeah. Okay. Yeah. Okay. So, Bill, one last comment.
I know a lot of the rural areas, the fire districts, I know our fire chief knows everybody in the district and knows who and where and has volunteers that take them sitting there.
I would echo that. That's true. I've talked with the Monument Fire Marshal or the Tri-Lakes Fire Marshal, and they have that information. But there's some challenges as far as sharing the information. Yeah, I mean, it just gets to that point again. It's collaboration, coordination, conversations, relationships. It's really working that diligently, day in, day out, up the chain, down the chain, across the chain, all that stuff.
And a final thing about this topic about the collaboration, I know for several who have been in the industry for a while, as far as professionals, it's very easy to get discouraged at times because a new idea will come up and we'll get all excited. There'll be a whole lot of energy behind it. How many committees have we been on together, Jen, where that's happening? You start to spin your wheels and it gets very discouraging. But one of the things I would also like to highlight, though, is that really great things also do come out of that energy and that desire. The elder shelter that came, and within 2 years, we have given shelter to 71 seniors who were being beaten or abused or self-neglect, and are on a national stage presenting that to the world. We have, look at what our new subcommittee, look at the different things that we have. Chris's entire organization has been how long now?
9 months?
Yeah. So I think as frustrating as it can be that there's a lack of coordination and there's a lack of maybe willingness, whether it's legislatively or even locally, I also would like to just encourage everyone that with the dedicated, encouraged, and willing people, really awesome things happen. I know it wasn't just Phyllis, Dave, but your insistence has helped get some of those rides and all that for the transportation for your people. It can happen. So as frustrating as it can be, we got to focus on the good things that do happen, because for all the 8 committees that fall to the side, 2 really good ones get work done. So it's got to be positive when we can. And I'm not suggesting that this was negative, but I think focusing on the positive will always help us reach forward with renewed energy.
Last 3 words: passion, purpose, and persistence.
Compassion with passion.
Passion, pardon?
Compassion with passion.
That's right.
Okay. Passion, purpose, persistence, compassion is the other one.
That's kind of turned into our little catchphrase accidentally.
Okay, so now we're on to, that's all I have to say. Good discussion. Good discussion, though, okay? So now action items, there are none listed unless somebody has one that I'm unaware of. We'll move on to discussion items. And again, we have a couple of things here. Melissa needs to talk to us about the 4-year plan.
And I can weigh on that if there's other folks that would like to, because I can bring that to our subcommittee group and present it next month.
Okay.
A couple of pretty serious things. I know that I was shared with y'all our concerns about the census and its effect on seniors, and all of us here know the results of the formula change and where that money comes from and all the programs that the census affects from federal dollars. Well, we now have formed a complete count committee with Park County. It was a lot of work. We got it to happen. I'm actually a co-chair of the senior subcommittee. There's a lot to be discerned by the changes in the calculating our seniors, and I will give you a fact. We went to our training yesterday that was shocking. Park County, in the last 2 censuses, were undercounted. Only 42% and 40% of our populace was counted in the last 2 previous censuses. So that's just the numbers alone that we didn't qualify for to bring into our area. And I don't think people are aware of the staggering amount of numbers that are supported by those numbers, those counts. So we have formed that, and thank you, Melissa, for your concern and your help in pointing me in many directions. We're already to the point that one of the commissioners is now the chairman, and we've set up our subcommittees, and we're moving forward. So that's a really big announcement we're very proud of. Aside from our Senior Expo on October the 18th, and I want to speak with Jody, and I want to speak with the Insight people and everybody else here about coming to do some booths there, but we also have now established the date for our transportation symposium. Our transportation symposium is going to be on October the 25th. We're doing that in conjunction with Mountain Resource Center. Our plan is at this time is to invite, Denver COG's already said they will be interested. I spoke to Joe about it also. Everybody that has a piece of the pie or an understanding to help us solve the problem of transportation in rural areas, especially specific to our area, since that's what we've set the symposium up. We're inviting CDOT, we're inviting senators, we're inviting everybody that has a stakeholder or piece involved. So that's another thing that we're moving forward progressively, and I just wanted to share that with y'all if anybody's interested in attending. And then I already shared the fire information, so I think we're good on that.
It's really important information that Chris is providing to us, and it's also representative of the commitment, the dedication, the passion, persistence, compassion that she has for seniors and for neighborhood, if you will, or region or area within Park County. And again, it's commendable the things that you're doing, and again, it's probably that 90-10% thing. 10% of her, she's really one of the key ones, so she's taken on more, she's taken on more, she's taken on more.
Yeah.
So just one of those challenges we all kind of have to grapple with. Yes, ma'am.
I also wanted to mention that 2 items could piggyback, and that is the fire mitigation and the census. It's possible that we might be able to get, if we concentrated on it, get people to recommend or tell us, about parents or neighbors or someone like that who might be undercounted, that could be seniors that need assistance as well.
Right.
So that might be 2 items, we can piggyback on when we concentrate on our censuses.
The census is set up in a 9-question format.
Yes.
And they're actually going to create, that's one of the things we're applying to a grant for DOLA. They have $6 million, and they have an additional $2,500 for support materials. But that said, there's a lot of speculation on how to approach those questions. We kind of batted around because we don't have an active count of our disabled, in need, special needs citizenship. That might be a good way to do it during our training sessions. We got the director of libraries for Park County to come to our CCC, and we're going to format most of our training sessions through the libraries. But we may have a problem introducing a secondary question as formatted on the census because of those 9 design questions, but it'll be a good venue to have people there to ask them independently if they would mind qualifying that information.
Yeah. Go ahead.
It can't be formally a part of the census, but maybe
And it's a great idea.
those 2 might be able to be intertwined.
Yeah. I think, again, it just points out the need for, or shows how things are interrelated and can be interrelated and can be worked collaboratively.
That just occurred to me, and this is just my marketing brain that gets a little crazy sometimes. One of the problems that we always have, whether it's here within the suburban area or whether it's more in the rural area, is the unwillingness for people to want to participate. They don't want people to know I need help.
Right.
They don't want to admit. I mean, that's a problem all across the board, particularly for the more rural areas, because it's, not I don't want to say prideful in a negative way, but they're very proud of themselves and the fact they can take care of themselves. But maybe one of the things that we could approach is the idea that with the fire mitigation or those other things, that if we're approaching people by saying we're trying to be sure that we have a good I don't know, list isn't the right word, but registration of those who would need assistance in the time of an emergency, people would be more willing to give me that information than if I were to ask them, do you need home care?
Yes. Oh.
They're not going to say, but if it's for a different reason, because it could potentially save their life, because we would know where they are, that might be really good data to have to be able to then, especially for you guys in Park County or even in more rural, because it's like, oh, well, this could help me. It's not saying I'm not taking care of myself. It's that I would be able to get out of my house if there was an emergency that might actually be able to help us get the right kind of information at the same time being able to get both things covered. Does that make sense?
Well,
It's how you phrase it.
Yeah.
Sure,
And
but-
it affects their reluctant, not, I don't want to say attitude, but it's something to overcome. You know, it's a reaction to overcome with the senior, and certainly how we approach them and share the information that our goal in the long run is to help them. That's something we think about all the time in processing how to dialogue with someone, to not be invasive, but to know that they're there and that the services are available, and help us know also what they need additionally as another component of that. There's a approach that we're trying to take as far as with the seniors. We started at a ground roots perspective and started going to all the events that they were a part of. And it was just a matter of slowly building trust that's made that change for us. And then on the second tier of that, it's a matter of all the background work of the phone calls, getting the support, not dropping it, following through with ideas and how we can make a difference. Now, it was suggested to me recently by someone that it would be a good idea to open a senior resource center in our area because there isn't any. And then I started doing some research looking into that. Boy, is that quite an endeavor. So sometimes it's almost like your intent is wonderful, but climbing the wall to get to your intent, it's amazing. It's almost like there's a system to set up to fail. But one thing that was interesting with our Complete Count Committee, DOLA produced a list, a recommendation of what was considered hard to count qualifiers. And the third thing listed was a population of people over 60. That was in their hard to count. The actual Census Bureau with their flyer publication, that is not anywhere in their hard to count demographic. There are 11 other qualifiers, but seniors aren't listed. So in our meeting yesterday, that was brought up, and I basically said, you know, I'm concerned, and they said, this is really true. This is without dealing with politics. The statement was made, well, you know, 10 years from now, they're not going to be able to do that because you guys are going to be right up there. There are going to be so many of you, they're going to have to recognize you. But right now, you know, it was really...
Okay.
Yeah, just one more statement to it to talk about collecting information and contacting the seniors that I have found in my area and in my experience is if you go and approach a senior saying, what can you provide as far as helping someone else? Because if they're not willing to help themselves or they think that they can take care of themselves, they're more willing to share information about what they can do for others. And that is very significant in rural areas.
Thank you. That's a really good point. Okay, so it's 11 o'clock. We've got a couple things here to talk on discussions. Let me just jump on this one. Okay, so two things. November meeting, when we schedule that one, Melissa's pointed out that the conflict with Thanksgiving is there, so we have to adjust that. Just know that that's going to be adjusted some way, one before or after. It was also suggested this morning that perhaps, especially for those that have to drive long distances, like from Park and Teller County to come here, a 9 o'clock start really means a pretty early start for their driving, and especially is problematic in the wintertime. So we might want to have a quick discussion. Do we think we need to adjust or look at the start time for the monthly RAC meeting? Well, Bill endorses that, yeah, I understand, but I mean, from the rest of us.
Yeah, just in terms of fairness, we do adjust those meetings 10 to noon when those of us from here have to go to Park or Teller County.
Excellent.
Why don't?
Okay.
Just a big question mark. Why have we never done that?
You're hired, Jody.
Yeah, thanks. So I'm all in favor. I don't know what my schedule is going to look like, but
Okay.
I'm voting yes for now
Okay,
for the
so
sake of the
Quick
amount of
consensus,
people
thumbs
coming
up or
through.
thumbs down on moving the time, recommending the time go to 10.
10 to 12.
Perfect, looks like
Yeah.
consensus is there. So let's go with that.
10 to
I
12.
think that's a great action or resolution from the group here. So we hit the start time, November meeting. The other thing I want to throw out was Joe's farewell. What do we want to do for that? I don't recall what was done for Guy Severa, whatever his name was when he left. But I think it's one of those things. Joe has been here 5 years?
Yeah, and PPACG will be doing a going away party, so you guys will all be invited to that, I believe.
I'm thinking more from the rack itself.
But if the rack too still, of course, wants to do something else.
We could do anything from, a little certificate, a little plaque, to anything else. Quick discussion. Let's not take a whole lot of time, but what are your thoughts?
Are you saying that you're going to combine it?
Well, we'd be
But there's- but
we'd be
you're
part
gonna
of
be
that, but I mean, at the final RAC meeting, Joe's there, Jody's incoming, Joe's outgoing. Joe, here's something for you.
I think
That would be from
plaque-
us, the members, if
I
that's what
think
we
a
want to
plaque would be nice, or something, and a card signed by the members.
That's it?
Yes.
Mexican food margaritas.
For that, you need 4 to 6 o'clock.
Good luck with
that
that one.
is for everything.
Right.
And like you said, of course, we'd all be welcome to attend that. But to have at the next meeting, which would be, we would all be retired, we would need to verify that we even be willing to come and apply for units. I think that would be appropriate to do as just us, to say,
Exactly.
thank you for your time.
Exactly.
A lovely card and a plaque of some kind, I don't know. But I think that's appropriate. Not at the big one with everybody else, but just at our next meeting, but we need to verify that he is not planning on going fishing.
Yeah, is the September 26th meeting, it should be
Here.
here, right?
Right.
Yeah, we'll both be here, to my knowledge, because that's my overlap time with him. We'll
Okay.
have about a week overlap.
Okay,
Okay, good.
so we'll do that then.
That'll work.
Okay?
Is that at start at 10?
Yes, that's the
Yes.
consensus from the group, that's the recommendation.
Yes.
When we
Yes.
schedule it, be 10 o'clock, yes.
Okay.
Good.
I get to sleep in.
I know. I'm so excited.
Okay, so we've hit the start time, we hit the November meeting, knowing that it's going to change. We touched on, we got something for Joe's farewell. Any other discussion items that anybody else might have before I turn it over to Melissa? Yes, Jody?
My current position, the Alzheimer's Association Regional Director for Central Colorado, will be posted soon. I will be forwarding that out to the entire RAC. Feel free to pass that along. And love to be able to participate and help train that person coming in and continue the momentum that we have for our region. And then my first day working with Joe will be September 23rd. So we will have about a week
Okay.
before his last day.
Is the Alzheimer's position going to be a regional search or a national?
It typically gets posted nationally, yeah, so I'll be sending out the link for that. Love to have someone from the area that already knows us. That'd be nice.
That would be huge. Anything else? If not, we'll turn it over to Melissa. She has some words on the 4-year plan.
So Dave and I have been talking quite a bit off and on about how to get the 4-year plan out to the community. We've talked about some different ideas. But one of the ideas that was brought up yesterday by some staff here were to actually do some videos talking about the different parts of the 4-year plan. And then putting that on our website, putting that out on YouTube, and just getting it going. And so that being said, If any of you all have a particular passion or interest about any of the parts of the 4-year plan and wanted to actually participate in doing, probably about a 3-minute video talking about the 4-year plan, we would coach you along, help you, so that you wouldn't feel like, well, what am I really going to say about transportation? So, we can work with you on what to say and how to do that, and so just wanted to put that out there. We're excited to kind of get that rolling and start that process, and would just be looking for a variety of people who would want to speak. I believe there are 7 different sections on the 4-year plan, and I should know this off the top of my head because I do look at it quite a bit, unlike a lot of folks, I'm sure. So I think there's 7 parts, so we'd probably be looking for 7 different folks to speak. And so if anybody's interested, you can email me. I can share more information about it, but that's what we'd like to do.
How about show of hands? Anybody interested in helping out on this? I think it's a really important piece.
Okay.
There's 5, 6.
No, I'm really uncomfortable talking.
Very shy and retiring, yeah. Very unused to that public
So there's 3, 4, 5, 6. So I think it's a really important thing, and it really sounds to me like it's almost like we walk into it with talking points, and it might be nice to have a dialogue with somebody else rather than just saying, well, I'm the face here, and here's the camera looking at me, and these are the 17 things or 3 things I think are really important. No, you want to have a dialogue. You might have somebody from a rural background with the urban background, or with, not to make it
He's
too
brilliant. All right, so now I'm looking for 14 people.
No, I'm just saying, I'm saying
I
just
think it's a
amongst
good
the
idea.
people here,
Yep.
you could still do that same thing.
Totally.
And it might be a little bit more lively presentation, and it might have a little bit more of a lasting impact or meaningful impact on the viewers to see, there's a conversation about this. It's a good point that Chris had, but Wendy said this, and here's why this is so important. So you get that passion, the purpose, persistence, compassion into that video. Much better than just a talking head, blah, 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 blah. Especially in media-saturated markets. Hello? Anyway, okay, that's good that we had that.
Yeah. So for those who, I didn't take down your name, so please email me. Thanks.
Seriously, I think that's an important piece. Again, getting the information out. Any other comments? That's great. So now we're down to the calendar of events. The next meeting is September 26th. It'll be at 10 o'clock in the morning here, 10 a.m. And from this point going forward, before we have the new director here, I guess we can set this in motion. Any other thoughts before we adjourn? Final comments? All those in favor? Aye. Adjourn. Thank you.
Thank you.
Perfect.
Thank you.
Chris, I want to talk with you.
I got some cards at the Fair Play Clinic presentation. No extension. Got some cards in 2
And